So hi everyone, my name is Justine. I'm a med student at the University of Ottawa, and this year I ran a research project with the center, and it was called Investigating the Relationship Between Seasonal Affective Disorder and Traumatic Brain Injury using the SPAQ in patients at the Ottawa Vista Center for Brain Injury Services. So just some key points from the introduction. So it's estimated that about 50% of people will actually suffer from a traumatic brain injury in their lifetime. Up to 40% of patients will suffer from two or more psychiatric disorders following their TBI. And there's also some growing literature that kind of links affective disorders to traumatic brain injury, more specifically axis 1 affective disorders, which would be things like post-traumatic stress disorder and also major depressive disorder. And it's also important to note that, patients of all severities of TBI actually have an increased risk of affective disorders following their injury. So it could be things like a minor concussion to, anything more serious, but everyone kind of runs an increased risk of developing affective disorders after these types of injuries. So for seasonal affective disorder specifically, in the DSM-5, it's actually a subtype of major depressive disorder. And so it's characterized by, episodes of major depressive disorder that also show evidence of like seasonal variability. So seasonal affective disorder hasn't specifically been looked at in the context of TBI, hence the idea for this project. So why we want to investigate the prevalence of seasonal affective disorder in a population with TBI? Well, first of all, we just want to help determine the amount and types of resources that would be needed for, rehab in these patients. So to properly understand and characterize, the issues that people could face after their injuries will help set up the proper resources for them. Also, there's evidence that shows that cognitive impairment after a TBI presents one of the largest barriers to reintegration in the community for these patients. Hence the need to properly characterize those barriers and help overcome them. Also, I won't get into all the details here, but there's a bit of a biological basis to look at these two disorders and how they're linked. So they have a shared pathophysiology that involves dysregulation of these serotonergic pathways in the central nervous system. So just to note a few of the points there, so studies have actually shown that there's a decrease in serotonin levels in the human brain depending on the season, with a minimum amount of serotonin in certain areas of the brain happening during the winter months, so December to January. We also know that serotonin is a key neurotransmitter involved in neuropsychiatric outcomes of TBI. And that's obvious by the fact that it's actually one of the targets of pharmacological treatments. A lot of these patients will be put on things like SSRIs, which are medications that will actually help increase the serotonin levels available in the brain. And we also know that TBI causes dysregulation of neurotransmitter synapses, and it's been particularly evident in patients that have frontal lobe damage, which is an area of high concentration of serotonin. And we also know that severe TBI has been associated with as much as a 17% loss of serotonergic neurons in the brain. So we know that seasonal affective disorder is correlated with, decreased amounts of serotonin in the brain. We also know that TBI, an outcome of that is effectively decreased serotonin levels in the brain. So there's a bit of a biological basis to investigate the two and kind of characterize their relationship. So our objective, like I said, was to investigate seasonal affective disorder in a population with traumatic brain injury compared to a control population, which would be people who have never had a TBI, using the SPAQ. And we hypothesized that, the global seasonality score, which is characterized with the SPAQ, would be higher in the population with traumatic brain injury compared to the control group. So our participants were patients from the Ottawa Vista Center for Brain Injury Services. And then, their family members who answered the survey were serving as our control population. So those having never had a TBI. And they were recruited via emails that were sent. So the SPAQ is a widely used screening tool. It's the Seasonal Pattern Assessment Questionnaire, SPAQ. It has a pretty good specificity of 94%. It's easy because there's no training required to administer, so it was easy to administer via a survey through email. And it gives us a global seasonality score, which is the sum of 6 items in the question number 11 of the survey. And then a positive screening for seasonal affective disorder is a global seasonality score of 11 or greater, and also a score of moderate or higher on question 17. So just to note here that this tool is not diagnostic of seasonal affective disorder, it's just an initial screening tool. And like I said, it's easy to administer, hence why we decided to use it for this project. And there's also certain covariates that we were hoping to look at. So along with the SPAQ, we're asking some demographic questions to participants, things like their sex and their age. And this was because, women have been shown to have a 1.5 times higher prevalence of seasonal affective disorder than men. And a study also using the SPAQ found significant negative correlation between age and global seasonality scores of the participants, meaning like the older the age, the lower the global seasonality score would be, and vice versa. And so these are things that we would want to look at and quantify based on the results. For the results, we had a total of 17 responses. And then based on these 17 responses, we did see a mean global seasonality score that was higher in a group which have had a prior TBI compared to the control group of no prior TBI. So the mean for the TBI group was about 6.5, and the mean for the control group was about 6.27. So like we said, it was higher for the TBI group. However, using stats, it wasn't statistically significant. Um, so yeah, basically, because the results were not significant, we did not go ahead and look at the covariance either. Um, so ideally, moving forward with this project, it would be ideal to recruit and use maybe other centers that have access to a larger patient population with traumatic brain injury. I do think if there was a larger population, that I think necessarily the results would have been significant, but they would have been easier to interpret for sure with a larger population base. Although, for anyone out there who did respond to the survey, thank you so much for your answers. But yeah, moving forward, hopefully, with the next group of med students that would come through the center, they could possibly look at partnering with other centers to get more responses and to continue this project, because I do think it's an interesting project. Like I said, it hasn't been investigated before, so it's pretty novel in that sense. But yeah, ideally, just more responses would be needed to run better statistics. But like I said, there was a slight increase in the global seasonality score of patients with a prior TBI. So it kind of indicates to us that, we could be on the right track here. It's just statistically, we would need some more responses. And so, yeah, a few of the limitations here was that the SBQ is a widely used screening questionnaire, but it may actually overestimate the true prevalence of seasonal affective disorder. So one thing to keep in mind when looking at results or results of future studies using the SBAQ. And like I said, due to some limited data, we were not able to run the covariate analysis to assess for the effects of sex and age on the global seasonality score. So because the results were not significant, we didn't go ahead with those stats, but would be interesting to do if we were able to recruit more participants. And then, yeah, further directions, like I said, would just be to aim to get more people involved in this, more centers that have access to people with traumatic brain injuries, things like concussion centers. There's a lot of family doctors' offices who kind of specialize in concussion care. So it'd be interesting to, widen our horizons there and get more responses. So yeah, those are kind of the future studies. And then that's about it for me and my presentation. I hope I didn't go over the 10 minutes, but happy Brain Injury Awareness Day to everyone. Thanks to Tammy for, helping me out with this and giving me the tools to kind of start this project and get the ball rolling. And yeah, thanks everyone for listening. And I wish you guys a great rest of your day.